Assalamualaikum and good morning to everyone. Welcome to my next presentation. The topic of my presentation is about rotating chair. This is the test which is used in the laboratory vestibular assessment. Okay, now let's take a look on this slide which show the diagram of the inner ear which included both hearing and balance organ, cochlea, semicircular canal and otolith organ. So as we can see here, each part has specific tests that we can use to assess its function. Several laboratory vestibular tests are available. As we know, both the caloric and rotating chair assess the lateral canal functions, the most easiest to stimulate as compared to the other canals. So the response from each ear can assess independently in the caloric test, while the both ears are tested simultaneously in the rotatory or rotating chair test. The difference is the caloric test will the stimulus is equivalent to a very low frequency, while the rotating chair will test at the middle frequency of the movement. And also the caloric test is an artificial method of reproducing a sinusoidal stimulus in the ear using the different temperature of the air or water, while in the rotating chair, we use the computer control to perform a true sinusoidal rotation or a step stimulation. So therefore rotatory chair is the best test that we use to expand the evaluation of the peripheral vestibular function, as it can stimulate frequency in the 0.01 to 1.28 Hz range, which are considered more physiologic frequencies. As an introduction, this test first described by Barani in 1907 when he recorded a nystagmus after patient was manually rotated while sitting on the chair. This response generated by sudden deceleration or nystagmus generated by sudden deceleration. So it's understood that the rotational stimuli will produce a reflex with slow eye movement in the opposite direction of the rotation of the chair with a rapid contralateral corrective circuits. So the examiner also noted a weak or absent response generally denotes the bilateral loss of the vestibular function. So the purpose of the rotational chair testing is to determine if the vestibular or inner ear or the neurological system is the cause of a balance disorder. It is also a physiologic test that can be used to assess the horizontal semicircular canal or lateral canal or the superior vestibular nerve. And it also used as a gold standard test for horizontal semicircular function when bilateral vestibular hyperfunction is suspected. So now we look on why we use the rotating chair in the vestibular assessment. So the answer is first we use it as a baseline and ongoing evaluation of progressive disorders such as in the case of Meniere's disease. Second, we use the rotating chair to monitor for vestibular ototoxicity, such as the IV gentamicin, because it uses multiple stimuli of varying intensity can be applied to the vestibular system within a relatively short period of time. Then we can use to rotating chair to assess the status of compensation due to dynamic testing across a range of frequency and intensities after the vestibular rehabilitation and balance retraining. It is also useful in testing children that will not allow caloric irrigation. So well, it's recommended as a vestibular assessment in children whenever peripheral vestibular involvement is suspected. So it can be completed in children as young as 2 months. However, the maturation should be considered. So now take a look on this diagram. I will explain on how we can understand the relationship between the head velocity and the slow phase velocity eyes movement. So it is important to realize that the VOR is designed to provide ocular stabilization during the head movement. That is to generate the slow phase eye movements that equal and opposite to the head movement. So compensatory eye movement after we move the patient, as example, to the right, proportional with the head movement, left ear will inhibit and the right ear will exhibit. So continuous movement can cause eye movements to the left and right, or we call it as a nystagmus. The SPV will represent the movement of the cupula in the canals or the horizontal canal. The three most frequently used battery tests in the rotating chair are sinusoidal harmonic acceleration and the velocity step test. In the sinusoidal harmonic acceleration test, the patient undergoes sinusoidal oscillation about a yaw axis at various frequency. Usually we use 0.01, 0.02, 0.04, 0.08, 0.16 and 0.23 and also 0.64 Hz with a peak angular velocity of 50 degrees per second. While the velocity step test involves the patient undergoing an angular acceleration of 100 degrees per second velocity for 1 second, and the rotation will be at a constant velocity for 60 seconds and a final deceleration to 0 degree per second within 1 second. So then the results were analyzed in terms of rotation towards the right and left sides. So now I will explain on how we do the sinusoidal harmonic acceleration or SHA test, one of the subtests in the rotatory chair test. So in this test, patient will be seated on the rotating chair and wears the seat belt to prevent falling out of the chair if the patient becomes dizzy after the test. Then the chair will oscillate in yaw at varying frequencies, about 0.01 to 0.64 Hz, typically with peak velocity that remain constant at 50 or 60 degrees per second. So we can see the relationship between head and eye movements during several cycles of this sinusoidal oscillation. And then the patient will have a nystagmus with leftwards slow phase when his head was moving to the rightward, and the nystagmus with rightward slow phase when his head moving to the leftward. So in this slide, we can see here a rotating chair in our clinic with the monocular infrared goggles. So in this test, the patient will sit on the rotating chair with the head tilt forward at an angle of 30 degrees using a small pillow which we put under the head of the patient to bring the horizontal canals in the plane of rotation. Then we put on a binocular or monocular infrared goggle which containing a cover to darken the area around the eyes to record the eyes movement. And the patient was fastened to the chair using a safety belt, and the head will stabilize in a head rest. Then the rotation will carried out with the subject's eyes open while performing a mental arithmetic in order to maintain alertness throughout the testing. This is because we want to increase the mental arousal in a tested individual to prevent the central inhibition of the nystagmus. So it can be in a form of a simple mental task such as counting or naming countries in alphabetical order. So for the sinusoidal harmonic acceleration or SHA, there are three vestibular ocular reflex parameters were calculated. Gain for eye velocity divided for head velocity. Phase timing relationship between the head movement and the reflex eye movements, and for symmetry measures shows the slow component eye velocity of right versus the left rotations. So at the bottom of this slide is an example of normal result of SHA rotating chair. So the three graphs represent the gain, asymmetry, and the phase. So the shaded area in this graph represent the abnormal area or abnormal response. So as we can see here, the response for each frequency is within the wide area for the gain, asymmetry, and also the phase here. So it means that the result is normal for this patient. Okay, so now we look on how we interpret the results. So if we get the result with low gain for all the frequency tested, it suggests for bilateral vestibular weaknesses. So it is usually a consequence of bilateral chronic vestibular weaknesses. And if the gain is abnormal low only at low frequency rotation, but normal gain at high frequency, it means that or it suggests for the uncompensated peripheral vestibular weakness. While when the gain is abnormally high, observed, it suggests for cerebral lesions because the absence of descending inhibitions, and this is much consistent with the oculomotor evaluations results. Now we look on the second parameter, phase. When it shows an abnormal increase in phase, it will suggest an abnormal low system time constant, which suggestive of peripheral system involvement. Maybe it's happened on the labyrinth or eighth nerve, although possible involvement at the level of the vestibular nuclei must be considered. And when an abnormal decrease in phase leads from a low frequency less than 0.04 Hz sinusoidal rotation, it implies that possible central system influence either at the level of the brainstem or in the posterior cerebellar area nodulus need to be considered. And for the asymmetry, which is a measure of compensation and is calculated as the difference between the slow peak velocity of the left beating and the right beating nystagmus. So when it shows of a high level of asymmetry, it will suggest for the peripheral vestibular lesions, especially for acute lesions, which will gradually decrease as symptoms improve. And when it shows a low asymmetry, it will suggest for the central vestibular involvement. Okay, next we look in the second subtest of the rotating chair, a step velocity test. So in this test, it involves a rapid acceleration of the chair in one direction with constant speed for 1 minute, and then it will abrupt deceleration of the chair. So the examiner will measure the time it takes for the nystagmus to decay in each direction of rotation or the peak nystagmus response. So the entire procedure performed with both clockwise and counterclockwise, with initial rotation with a 2 bursts of nystagmus for each rotation. It will be a pre-rotary nystagmus, which start with the initial acceleration of the chair, and the post-rotatory nystagmus, which starts with the complete stop of the chair. So the derived parameter of this test is the TC, or we call it as the time in second for the nystagmus. slow component velocity to decay to 37th of its peak value. So overall, 4 time constants were identified for each patient. So next, as I mentioned earlier, the step velocity test was composed of 2 sections. In the first section, the chair was accelerated in one direction until until reached to a preset constant velocity, 100 degree per second, and it will maintain for a designated length of time, about 45 seconds. And during this section, a sudden burst of nystagmus will occur as the chair was accelerated, but the nystagmus response will decrease as the chair will maintain rotation at a constant velocity. So when the chair was decelerated to a complete stop at a 0 degree per second, the ice movement will continue to be recorded. And then the sudden stoppage will cause the nystagmus will occur in the opposite direction, as the patient will perceive this stoppage as a motion in the opposite direction. And the nystagmus will again decay until ice movements stop. So the entire procedure was repeated with the initial rotation in the opposite direction, clockwise and anti-clockwise. Then for both sections, the computer will automatically carries out the data analysis, which is it will calculate the gain and the time constant. So as we can see here, this is a result of the step velocity test. So this is the screen with the graph. So the data point for each per rotatory and post-rotatory step at each velocity tested will appear as a triangle in the gains, time constant, and the symmetry graph above the tracing on this summary screen. So the data point will appear in the white region when the results are normal, and it will appear on the shaded region when the results are outside of the threshold limit. So the patient with the unilateral peripheral vestibular lesion will show directional asymmetries in response to the velocity step stimuli. And if it shows a reduced time constant, it may be associated with the unilateral or bilateral vestibular pathology. And it has been suggested that abnormal long time constant it may be associated with the motion intolerance or cerebellar involvement. Okay, in this slide shows the normative data for step velocity parameters by Ahmad 2014. So in this research shows there are no significant difference between the study group and the manufacturer data. So it may be because of the strict selection of the criteria of the study group. So we may suggest to have our own normative data in our setting, but we can also use the manufacturer if we don't have we don't have our own normative data. So next, we go to what is the contraindication to perform the step velocity test. So for the patient who are very claustrophobic or having an extreme fear of confined place may not be able to tolerate with the rotational chair testing, because we perform this test in a total dark room. As well, if a patient who reports significant nausea from the test, and this test should be discontinued. So that's all the brief explanation regarding the rotating chair. So let's now we move on the advantages and disadvantages of the rotating chairs, studies by Radomskic in 2015. So this rotating chair considered to be a gold standard for the assessment of bilateral vestibular dysfunction because in this test it stimulates the ear simultaneously, different as compared to the caloric testing. Besides that, this rotating chair test will test the frequency of 0.01 Hz in combination with case testing, may be more sensitive but less specific than caloric testing at identifying unilateral peripheral lesions. So it also can use in identifying the unilateral peripheral lesions. And it's also easily tolerated by the adults and children, and it will test a wide range of frequency and peak velocity, specifically the frequency components 0.01 to 0.32 Hz, which this frequency is significant components of the vestibulogram. So what is the disadvantages of the rotating chair test? In this test, the whole body rotation tests are mainly designed to test only the lateral semicircular canals, which is only the 20% of the vestibular labyrinth. We also have the posterior and the anterior canal. So both in this test also the both labyrinths are tested simultaneously. Therefore, it is difficult to provide ear-specific information. Even with techniques such as the sinusoidal pulse test paradigm, it also cannot test the ear-specific function. And lastly, it's a relatively expensive test because the cost of the chair is very expensive. Also, the software, included the software and also the goggles. As a final point, I would like to show some findings of the research related with the rotating chair from the literature review. So from earlier study done by Hamid MA in 1990, which suggests that SHA testing has contributed significantly to fully evaluate the vestibular system and has become an essential part of the complete vestibular laboratory assessment. This also, the other research also showed that rotating chair has a higher sensitivity in detecting peripheral vestibular pathology. And also Mais et al. 2011 also agree with the previous earlier study done by the Hamid and A, which he suggests that a combination of rotatory, caloric, and VAM testing will result in a more complete examination of the vestibular system. Maybe it is because the major clinical advantage of this rotating chair, it uses a computerized rotational testing, which it's able to produce angular acceleration that can be controlled precisely and repeated. Okay, that's all from me. Thank you for your listening.